Welcome to pre-trip preparation session number 4. By now, I imagine you guys are getting pretty excited about the trip. You'll be here before you know it. I want to start you thinking about how you're going to be actually working with clients. Today and during the next few days before your trip, I want you to be able to recognize how the cultural context, specifically language, will impact your treatment sessions in Ecuador. I want you to come up with a list of key words that you use in therapy and translate them into Spanish so you'll be ready to start some treatments directly with the clients. And I want you to think about what nonverbal strategies you'll use during treatment when you just can't come up with the word that you need. I thought I'd do this by introducing you to Julian. He is a 4.5. His birthday is in September, so he's almost 5. He has Down syndrome. He has a number of goals that we're working on. Just in general, he needs to increase attention span. He needs to follow verbal directions, fine motor and gross motor coordination, cognitive skills, about the kinds of things you'd expect a 4.5, 5-year-old to need to do. We've been working on donning and doffing shoes. Fine motor coordination was specifically requested by his mother. He could use some gross motor work as well, but since she had requested the fine motor, we've been emphasizing that. I hope the PT students will do a nice evaluation with him and perhaps come up with some suggestions, and we can talk to the mom about that. He does have a low frustration tolerance with the fine motor. He'll probably like the gross motor better, actually. We've been working on a visual schedule to teach him specific sequencing. The next thing I'm going to do is play a short video for you of a 2 to 3 minute segment of one of our treatment sessions with Julian.
Eso, muy bien. Rojo, muy bien. Rojo, amarillo, sí. Ya. Mira, este es azul, este es verde, ¿listo? Azul. ¿Dónde es el azul? Eso, muy bien. ¿Qué color es? Amarillo. Muy bien. Verde. Verde. Oso, verde. ¿Dónde es el verde? Busca bien, busca bien, busca bien. Ah. Eso, ¿dónde está el verde? Muy bien.
Okay, so now you've seen a little bit of the reality that, yes, we will be working in Spanish, and if nothing else, you know now that you need to practice your colors, maybe your numbers. What I really want you to do is identify some keywords, especially for your use in your profession. The PTs and the OTs will probably have some different things that you'll want to practice. For example, are you going to be able to say jump? Are you going to be able to say put your hands up? Things like that. So whatever you think you will need to know, not just for this little guy, but in general for your treatment sessions in Ecuador. What I want you to do is post some keywords in Spanish on the Moodle site. Let's just start brainstorming what ideas, what words you're going to need, and also identify nonverbal strategies. So that will be your homework for this week, to post on Moodle a list of words that you're going to be using. Dr. Perry, Dr. Provident, and I will be following the Moodle site right up until your departure. And also, if you have any last-minute questions apart from the forum, you can always write me at crecer.ecuador@gmail.com, and I will answer anything that you might have a concern about. I'm looking forward to seeing you soon. Hasta luego. Ciao.